Okay, today we're going to discuss hospice nursing. It's a presentation by Ada Willis. Now, if you are a healthcare worker, then you have more than likely interacted with hospice. Hospice is a big part of the dying process, especially for our patients. Hospice will work in collaboration with the interdisciplinary team to make sure that a patient has a peaceful and comfortable transition between life and death. Just like how labor and delivery nurses have a big part of the process of birth, hospice has a big part of the dying process. Okay. The primary activities of a hospice nurse are providing direct care to the patients, which means interacting with the patients, assessing them, seeing if they need more pain medication or anxiety medication. A lot of times hospice nurses will give a patient oxygen just for the comfort measures, not to prolong the dying process, but to make sure that they are comfortable as they go through the dying process. They provide psychosocial support to their patients, and they act as an advocate, as nurses do act as an advocate for their patients. They ensure that their patients don't die alone. The families will usually want to be there with the patients as the dying process is happening, but sometimes they don't make it in time, but the families always are happy that a patient has somebody. They help continually improve the quality of patient care, which, goes back to what we were discussing with helping the patient be comfortable and not anxious. And they provide emotional and spiritual support for their patients, like they'll get a chaplain if they're religious. They provide emotional support because, people can be scared, as they go through this dying process. And they also provide emotional support to the families. Scope of practice. The contemporary meaning of hospice refers to palliative care of the very old and dying, reducing distress from physical, emotional, and spiritual symptoms, which it's trying to keep them comfortable and reducing distress. Like, if a patient's having a lot of secretions, when they start to get that death rattle, they'll give them something such as atropine to dry up the secretions. We already talked about the scope of practice for hospice. Teaching and learning strategies. The primary goal for hospice is to help maintain the client's dignity and comfort. Dying with dignity is something that's very important. And being comfortable, nobody wants to imagine going and being in a lot of distress. The teaching strategies would be to teach our families about communicating with each other about essential sensitive issues related to death and dying, and to teach them to perform non-pharmacological interventions to lessen the dying's pain, such as repositioning, giving them, a lot of pillows. They would talk about, what they want to do after death, if they want to be scattered somewhere, do they want to be buried, what would they like to happen at their service, and things like that. And the nurse can act as a teacher and a facilitator and help them get through this whole process. Educational preparation required for hospice. An ADN degree, which is an associate degree in nursing, an RN licensure, which is, of course, passing the state boards. They prefer BSN, and the MSN is recommended for further advancement. Now, that's not to say that they wouldn't hire LPNs. I personally know a lot of LPNs that do work in hospice. And the hospice and palliative career care nursing certification is something that would also be good. Other disciplines or professionals involved: volunteers, chaplain support, respite care, to help the patient's family, because it can be a lot, and there are groups to assist with financial help with medications. There's hospice doctors, which can provide pain medication. There's hospice CNAs to help repositioning, cleaning the patient up and things like that, and home health aides, which perform a lot of the same duties as a CNA. And there is bereavement counseling, because of course, when a loved one passes, that does leave a certain amount of distress upon the family member, because obviously, you care about your family. Necessary skills and abilities. Healthcare providers who work with dying patients often experience unique stress, because dying isn't something that would make one happy, but especially if they've lived a long and happy life, then it can be like going to sleep after a long, long day. Coping mechanisms and self-care are important, just like with any branch of nursing. You need to make sure you have that you time, like going to the gym or going to get a manicure, things like that. And you need to have a firm foundation in home care skills, because a lot of the time the hospice team will take care of the patient once they're at home. There are some inpatient hospices, but a lot of it is done at home too. Necessary skills and abilities. You need to be able to comfort with death and dying, and remember, it's not about you and your feelings. It's about the patient, and you want to comfort them and make them feel comfortable with you in the whole dying process. And you need to meet the personal emotional needs for the patient, as well as the emotional needs of the hospice client and family. You need to be there for them, just like we are there for our patients in the hospital when they feel alone or scared. And you need to have a knowledge of community resources, like just making sure that they know, funeral homes, places that will help with the whole paying for things when the patient dies. Community hospice, I know, takes Medicaid, so we could help them enroll in Medicare, things like that. Okay. What's so great about hospice? Well, hospice is wonderful. I definitely meant that being satire, because hospice is, in my opinion, one of the best branches of nursing, because you really have to be a special person to be able to deal with so much death day in and day out. And I would imagine, it's hard, of course, with the geriatric patients, but it's very, very hard with the pediatrics, I would imagine. Mahatma Gandhi said the best way to find yourself is to lose yourself in the service of others. And that is something that I wholeheartedly believe in, because being a public servant is probably one of the best professions that you can be in, because you have to completely step outside yourself and just think about how you could help the community and things like that. Hospice nursing is not an easy profession to be in, but the loving and kind care makes all the difference. Just like all the loving and kind care on the floor makes a world of difference with your patients. Being there for the family, and of course being there for the patient, is something that is just completely wonderful and selfless, and kindness does make all the difference, and a little bit of kindness with the patients and their family does go a long way. Thank you for listening to my presentation. Here's my references.